We're going to look at learning outcome 2 for research in health and social care today. Now this has got 4 assessment criteria in it. So the learning outcome is be able to plan a research project relevant to a health and social care setting. So in here today we're just going to talk about how we can plan it, what we need to consider when we're carrying out our research. So there'll be a few pointers within this lesson.
Yeah.
So the assessment criteria are 2.1, identify an area for a research topic. 2.2, construct aims and objectives for the research topic. 2.3, apply ethical considerations relevant to a chosen topic of research. And then 2.4, conduct a literature review of the chosen area. So let's make a start. So when we go into here, I just started off with some ideas of how we can think about generating a research project. I mean, you've already got a very good idea about fibromyalgia.
Yeah.
So that's a good area to stick to because it's healthcare related. But when we're looking at ideas, we need to make sure that we do rational thinking and creative thinking. So for rational thinking, look at your own strengths and your interests. So you've already got a background knowledge about that topic, so it's a fantastic one to go for. Look at any past project titles because you want to make it easy for yourself. You don't want to be doing something from scratch because it's not a university level research program that you're doing at the moment. You don't physically need to go out and conduct research, on the street. So make your life easier. See if there's something similar that you can use information from.
Yeah.
Discuss it, with colleagues or with someone that you trust, or even think about it yourself. Search the topic, put it into the internet, look at if there's any YouTube videos out, scan any type of media, just see if there's already information there. And then when you're doing creative thinking, you might find a topic that is there already, but you might want to tweak it a little bit, and you might want to change the objectives or the aims of your research. Then you can combine a few different pieces of research together. So keep a notebook of ideas, look at your personal preferences, relevancy, I don't know why I put trees there, I'll change that, brainstorm, and do a concept map. So, write fibromyalgia in the middle, have little offshoots coming off it with little ideas. Yeah. So a good topic, when you're considering a good topic, you need to look at the data availability. There needs to be enough data there so that you can actually use it, so that you're saving your time and you've got a reliable connection. You need to use websites that are reliable as well. So, but when you have knowledge about topics, you'll know whether or not it's fake or real data. Look at the access to data. If it means you're having to buy books or you're having to trawl through 10 hours of videos, there's no point in doing it. See what's accessible within your time. Again, that leads us into how much time you've got. You don't want to you've got 2 weeks to do this, you've got a job that you're working on, you've got family life, you've got your personal life, you want to be able to fit this into that. So if you've only realistically got an hour or 2 hours a week to do this, look at something realistic, find the easiest route for you.
Yeah.
Then look at the resources you've got. So there'll be software, maybe there definitely will be published materials. You'll have something available, especially within healthcare. There's a lot of research projects that have gone on. Even news articles or clippings, there's a lot of things available normally. Then look at your own capabilities and skills. So now if I was to go on and say I'm going to create this really complex Excel program, I wouldn't be able to do it. I can do my basics on Excel. I can make charts, put down my data. If I'm going to do something that's all computerized and you click a button and all this information comes up, I wouldn't be able to do it. So look at your own skills.
Yeah.
And then look at the symmetry of potential research outcomes. So it's nice to have positive data, but to make it true, sometimes you need to be able to show the negative data in there as well. So not everything is always sunshine and flowers. So you need to have something showing negativity in there as well.
Yeah.
And that's that for 2.1. It's just quite simple. What to do, what sort of skills to use when you want to look at a research topic. So you've already done this. This section for you has already been identified because you know exactly what you want to do.
Yeah.
So for 2.2, construct aims and objectives for the research topic. So once you've got an idea, one that you're familiar with and one that you've got knowledge about, you need to think about what is the aim of your research, what are your objectives, and what sort of results are you expecting. So that will help you choose your objectives and set it out. So when you're doing writing aims and objectives, choose verbs that will let you actually achieve your aim. So you need to be able to choose a verb that will actually let you, analyze or write down your research in detail. So we always suggest something like analyze, evaluate, assess, determine, or compare and contrast. We always ask you to avoid, discuss, and describe because one, they're too open-ended, and number two, you can't really do much. Once you've discussed something, once you've described something, that's it. You can't really put your own judgments in. You can't really support it with too much information. It's just a couple of paragraphs and you're done. So we always suggest using one of the above.
Yeah.
Then we've got a couple of examples for you here. Now, not all of these are healthcare related, but I thought I'd give you an idea of how to put an aim down and how to make objectives for it. So the aim of this example of this is a research project on the UK membership of the EU. So the aim for you on this project would be to determine whether the UK should remain a member of the European Union. So this was around when Brexit was happening.
Yeah.
And then objectives would be to review the literature on the EU, to evaluate the costs and benefits of the EU membership, to conduct primary research into views on the EU membership, and to make recommendations about the future of the UK membership of the EU. So again, you've got your title, you put down your aim, what you're aiming to do, and then you list a few objectives. Even if you're saying to conduct secondary research or to conduct primary research, that's still an objective.
Yeah.
Then the second one, this is more healthcare related in a way. Then we've got a research project on recruitment practices at Calderdale Social Services. Now, this is more based on the CRB, so the disclosure and barring.
Yeah.
Aim of this would be to evaluate the impact that the Criminal Records Bureau Disclosure Service has had on the recruitment team and their practices at Calderdale Social Services, and then also to determine how problems experienced by the CRB during the introduction of the disclosure service have affected the recruitment team and the work at Calderdale Social Services. So there's two aims here. Then the examples for objectives on this research project would be to review and critically analyze the literature concerning the CRB, recruitment and selection, and also the relevant legislation.
Yeah.
To devise and implement appropriate research methods to appraise the disclosure service and determine its effects on recruitment. To examine any problems experienced by the CRB and evaluate their impact. And then finally, to generate recommendations for the future development of research. Now, when you're doing your objectives, I always suggest you put an objective in where you're talking about recommendations, because it's put into the specs that you need to put recommendations down at the end of your research. So make that as one of your objectives as well. So you could just put the same titles here to generate recommendations and then change it to reflect your research project. And now we've got types of research aims. So why do people do research? What's the whole purpose of this? And there's a few things. It's because somebody wants to investigate a certain phenomena or a certain area. You want to inquire, get more information. You might have information already, but you want to examine it a little bit more, see what the reasons for a certain thing are, what sort of treatment options there are, to explore it, to explain it to someone. Maybe it's something that's quite relevant to your area of work, something that you see on a daily basis. So you want to conduct research so that you can be able to explain things with a more educated manner. And then again, to study, you might want to carry out if it was a big research project that you were conducting for work, you might want to have patients as a case study and examine the effect of fibromyalgia on them, what medication works for some people, what medication won't work for others, what can they do to ease their pain. Because from my awareness, it's not treatable, is it? It's not curable. It's something that's managed by painkillers. So you could go down that area. But again, all of these, what you'll be doing is a lot simpler. So you'll just be sitting down, you'll be doing secondary research, you'll be at your laptop, use your own knowledge as well, and anything that you've got around work that you might have literature that you can use, do that. You're not physically having to go out and carry this research out.
Yeah.
Then the final slide for this little section is, hold on, let me just check one thing. Yeah, there you go. So for this is, put down research questions. So we've got a couple of here. So research question might be, why have organizations introduced team briefing? And then the objective would be to identify organizations' objectives for team briefing schemes. The second research question, in general, these are, how can the effectiveness of team briefing schemes be measured? And then you put the objective down to establish suitable effectiveness criteria for team briefing schemes. So it's quite simple really when you get into it. It's get a question, put down the aim, and then put down a couple of objectives why you're doing it.
Yeah.
So that's 2.2. Do you have any questions or anything you'd like to add?
No, everything's fine up to now. Thank you.
So when you're doing this for 2.3, apply ethical considerations relevant to the chosen topic of research. So we're looking at ethics. Now, it's not as difficult as what we think. We're not looking at, deontology or consequentialism where you're seeing if 10 patients can be treated for the same amount of money, why would you spend that money on one person who may or may not survive? We're not looking anything into that. We're just looking at basic things here. So confidentiality, data protection, agreements with participants, research governance, and reading critically. So confidentiality just goes without saying. You don't need to add your... Now, whenever I do any type of work when I was at school-based, any type of reports I did or observations I made, I would only put down the initials of the pupil that I was with. If I was going to write a report about you, I wouldn't put down your full name. I'd put AC down.
Yeah, just initials.
Yeah, just initial it, or, give them a child A or pupil P, so just put the initials down. You don't need to put down their age or their ethnicity.
Yeah.
Data protection, you know how that goes with don't share irrelevant information with people.
Yeah.
If you were doing a physical participation, something that you were going to look at real patients where you're going to see the effect of them, you'd need to put down an agreement with them where you'd be saying that I'm going to conduct this research. Are you willing to participate for 6 weeks? And then be a written agreement. Now, research governance is by the HRH, Health Research Authority. Now, this is it's quite simple. It's just there. It's a process to make sure that the quality of research that you're doing is at a good standard, and also that you're protecting your participants' rights, their well-being, you're safeguarding them, they're not put at danger. And then last one on this, reading critically. So critical reading, just make sure that you read the information with the knowledge that you can understand, so that you know that, yeah, this is correct, or don't use it just because it suits you, in other words. So when you do get into your actual research, just make sure you put a section down. And I was creating the assignment brief yesterday, and I've put extra information within the assignment brief of tips and information that you can use. So it will be a lot clearer when we do this next in a couple of weeks.
Yeah.
But have a section with ethics in it, say that I have considered the ethical approaches and considerations for my research, and then just put a number of these down into it.
Yeah.
So identify your topic of research. It has to be health sector related. So I've got a couple here, but you've already got a good idea, which is good. So impact of COVID-19 on businesses or the NHS. Opt-out of organ donation. Understanding nurse retention and its impact on patient safety outcomes. And then NHS 111 services for children and young people. So a few titles.
Yeah.
And then this is a good website to look at. I've actually loaded it up now already. It's here. So it's got a good number of topics on here.
Yeah.
All alphabeticalized and things. So you can just look in, see if there's any information you can find to support your research. If not, just go online and do it from there.
Yeah.
So identify your aims and objectives of the research. So look at the sampling size. So if you're going to physically go out and conduct a research, how many people are you looking at? Are you looking at 10 people, 20 people, or 100 people? Where are you going to collect the data? Are you doing it within your own organization, within your own setting? Or are you going out into a bigger setting, like maybe a particular department in a hospital and working there? Who are the research participants? How many are there? And then again, focus on secondary research. It saves you a lot of time. If you were going to do this primarily, you could do surveys and interviews. But again, I suggest secondary is much more easier.
Yeah.
So yeah. You know what? I've gone straight into 2.4 without even realizing it. I always do this when I get into really get into a topic. So we're currently looking at a Conductor literature review of the chosen area. So this is how we're going to do it. So yeah, the identify aim section was for the literature review. So the literature review is actually you physically just writing down or putting down the information about the topic you've chosen. So you've put down your introduction, you put down your title. You've given me an aim of what you're aiming to do. You put down some objectives. And now for your literature review, you start with an introduction. So introduce the study, put down your aims and objectives. That's already been done, so you don't need to do that.
Yeah.
The literature review is you're physically just doing it now. So you're physically just making a review, writing down what you found out. If you want to, you can prepare a conceptual framework. It's not necessary, but it's a nice, if you can find something image-wise to support it, that'll be okay. But if not, that's not too bad. This is a conceptual framework. Like I mentioned, I think it was yesterday. If we were looking at depression as a topic, depression is a dependent. So it's not a singular variable that just happens on its own. Things lead to it, the stresses that will indicate towards depression.
Yeah.
Got stress, which is independent, sleep disorder, which is independent, and troubled adolescence. I put down finances, work, family life. There's a million things that can go into it. So if there's something similar that you can find, that's okay. If you just want to put down something that might relate towards increased pain or increased effects of fibromyalgia, then that's okay as well.
Yeah.
Then the third section for your literature review is your choice of research methodology. So are you doing qualitative or quantitative research? Note down exactly how you research. So this section is you physically writing down, this is how I conducted my research. Did you look at case studies? Did you look at surveys? Did you do primary or secondary research? How many people did you look at? How many samples did you look at? What was the area of your approach? So just on this section, just write down exactly what you did to do your research.
Yeah.
And then data collection. You're just putting down, you're presenting your data. So anything that you've written down, put it. To be honest, the literature review is you presenting your data. So in section 2,
Yeah.
to support that, put down some tables or graphs or charts, because that's the thing that we need into here as well. Analyze your findings. So what did you find in that data? And then put an interpretation down so it's easy. So I don't know much about your research topic. I know basics, but just think that you're explaining it to me here. So put down in simple words what your interpretation was.
Yeah.
And then if you've looked at a couple of pieces of original research, you can actually compare your findings to that research. If you're just using mainly information off that research, you don't really need to compare it to that.
Yeah.
And then put down a summary. So what were your findings? Again, summarize it. Put down recommendations. So make sure you do say that in the future I'd like to do more detailed research on this and find A, B, and C. Or I believe that this research was beneficial because it will benefit my organization in this way. So I suggest we follow the steps or the procedures that I found in here.
Mhm.
And then you can even put down what your limitations were. Maybe you didn't have enough time. Maybe you wanted to go out and do field study, but because of COVID-19, you can't physically go out and do that now. So put down what sort of limitations you had and how you'd like to, if you were to do this research in the future again, how you'd like to do it.
Yeah.
And then reference it. So any images and things that you use off the internet, they will be known as your appendices. So if you copy and paste it off the internet, just get the search bar, copy and paste that into your references so that it's all referenced. So that is quite simple on here. Let's get back to the end. So we just looked at how to identify a research topic. You've already got a really good idea. Put down your aims and your objectives for the research topic. Write down what considerations you took into mind when you were doing it. And then write down your how you actually did your literature review, what sort of research you did and how you did it and what you might do in the future and how you might fix any problems you faced.
Yeah.
So that's it really on this. Is there anything you want to go over or ask? Or
no, it was pretty self-explanatory this
Yeah.
time around, whereas yesterday I was kind of a bit overwhelmed by it, but today it's...
Yeah. Because yesterday's section, what you're going to do is you're physically going to answer those questions and learning outcome one. You're physically, after you've done your research, you're answering those questions. With this, all of 2, 3, and 4 gets covered by you physically just doing a research project. There's a few points that you have to make sure that you've included in, but I'll make sure to let you know exactly what needs to be included into it to cover each section. But overall, it's quite straightforward.
Yeah.
I mean,
definitely.
turn the recording off.